Hello, let's discuss anatomy of the forearm. In this lecture, we will be discussing the muscle of the forearm, the interior compartment, its innervation and its blood supply. Okay, so the forearm, these are the cross section of the forearm. The forearm is divided into two compartments, interior compartment and posterior compartment, by the ulna, radius and interosseous membrane. Okay, so this is ulna, this is radius, and in between the two bones is the membrane called interosseous membrane of the forearm. So these structures divide the forearm into two compartments, interior compartment and the posterior compartment. About the interior compartment, it is also called flexor of the forearm, while the posterior compartment is also called extensor of the forearm, because the interior compartment main action is the flexion of the wrist, while the main function of the posterior compartment is extension of the wrist. So first, in this lecture, we will discuss about the muscle of the interior compartment of the forearm, which are the flexors, main flexors of the wrist and hand. Okay, so this is the cubital fossa, and distal to the cubital fossa, this is the interior compartment. This is the wrist joint, and distal to the wrist is hand, while proximal to the wrist is the forearm, the interior compartment of the forearm. So this is the palmar surface, or you can say this is the interior surface of the forearm. Okay, so interiorly, in the interior compartment, there are two layers of muscle, superficial muscles and deep muscle. So the superficial layer of the interior compartment has 5 muscles, while the interior compartment deep layer has 3 muscles. So in the superficial layer, this is from lateral to medial. The most lateral muscle is pronator teres. Okay, it doesn't cross the wrist joint, so it has no role in the flexion of the wrist joint, but it is the main pronator of the forearm. It helps in the pronation of the forearm. Okay, then the medial to the pronator teres is flexor carpi radialis. Okay, this is the flexor of the wrist joint, and it also responsible for the abduction of the hand. Then lateral to medial to it is palmaris longus. It helps in the flexion of the wrist joint, and sometimes it is absent. Then the flexor carpi ulnaris. Okay, flexor carpi ulnaris, it helps in the flexion of the wrist joint, and it also causes the adduction of the hand. It causes adduction of the hand, while the flexor carpi radialis is the abductor of the hand. Okay, then the last muscle in the superficial compartment of the interior compartment is flexor digitorum superficialis. Okay, flexor digitorum superficialis is deep to these 4 muscles. Okay, and flexor digitorum superficialis is responsible for the flexion of the metacarpophalangeal joint and flexion of the proximal interphalangeal joint. All of these muscles are supplied by the median nerve, except flexor carpi ulnaris, which is supplied by ulnar nerve. Okay, so pronator teres, flexor carpi radialis, palmaris longus, and flexor digitorum superficialis, these muscles are innervated by the median nerve, while the flexor carpi ulnaris is innervated by the ulnar nerve. So these are the superficial muscle, superficial compartment muscle. Now the deep compartment has three muscle. This muscle is flexor digitorum profundus, and it is responsible for the flexion of the metacarpophalangeal joint and flexion of the proximal interphalangeal joint and distal interphalangeal joint, and it is innervated by two nerves. The lateral part of it is supplied by the median nerve, while the medial half is supplied by the ulnar nerve. Okay. Flexor pollicis longus. Flexor pollicis longus, this is flexor, one of the deep muscle in the interior compartment, and it is responsible for the movements of the thumb. Okay, so movement of the thumb is done by the flexor pollicis longus, one of the deep muscle of the interior compartment of the forearm, and it is innervated by the median nerve, interior interosseous nerve. Okay, one of the branch of the median nerve is interior interosseous nerve, flexor digitorum profundus. Its lateral half is innervated by the interior interosseous nerve of the median nerve, while the medial half is innervated by the ulnar nerve. The third deep muscle is pronator quadratus. Okay, so this muscle, which is the deepest muscle in the interior compartment, is pronator quadratus. Okay, so this is pronator quadratus. Now, and it is innervated by the interior interosseous nerve of the median nerve. So the nerve which innervate the interior compartment of the forearm is median nerve, except flexor carpi ulnaris and medial half of the flexor digitorum profundus. These two muscle, one and half muscle, okay, medial half of the flexor digitorum profundus and the flexor carpi ulnaris. These muscles is innervated by the ulnar nerve, and the median nerve innervate all the other muscle of the interior compartment. Now we will first discuss these superficial layer of the interior compartment. So the first muscle is pronator teres. One thing about the interior compartment muscle is that most of them is originated from the common flexor tendon, which is just in front of the medial epicondyle of the humerus. So the flexor compartment muscles mostly originates from the common flexor tendon, which is in front of the medial epicondyle of the humerus. Okay, so the pronator teres, it has two heads. Medial, the superficial head originates from the common flexor tendon, while the deep head, it is originate from the ulna coronoid process. Okay, and it get inserted on the upper half of the radius on the lateral side of the lateral border of the radius, and it helps in the pronation of the forearm. Okay, so it gets originated from the two heads, deep head and superficial head. This is superficial head from the common flexor tendon in front of the medial epicondyle, while the deep head originates from the ulna. Okay, in between the two heads of the pronator teres, the median nerve travels down into the forearm. Okay, so I will show you the median nerve in between the two heads of the pronator teres. Okay, so this is the median nerve in the cubital fossa, the most medial structure, and it travels down into the forearm in between the two heads of the pronator teres. This is the deep head of the pronator teres, and this one is superficial head of the pronator teres, and the median nerves runs or travels in between the two heads. Okay, so this is the median nerve, this is the deep head of the pronator teres, and this is the superficial head, and median nerves travels in between these two heads. Okay, so this is the pronator teres. The second muscle is flexor carpi radialis. The pronator teres is innervated by the median nerve, and the arterial supply of the interior compartment is from the radial artery and ulnar artery. Okay, the second muscle is flexor carpi radialis. It originates from common flexor tendon in front of the medial epicondyle, and then it insert by two heads, the one head on the second metacarpal and the second head is on the third metacarpal. So it insert on second and third metacarpal bones. Okay, its main function is flexion of the wrist joint. Okay, and also it causes the abduction. Okay, abduction of the hand, and it is innervated by the median nerve. The third muscle is palmaris longus. It gets originated from the common flexor tendon, and it inserted in the palmar epineurosis of the hand. Okay, so it's insert on the palmar epineurosis, and it causes the flexion of the wrist. It is innervated by the median nerve, and sometimes the palmaris longus can be absent. Okay, the most medial muscle is flexor carpi ulnaris. Okay, so flexor carpi ulnaris, it also originate from the two heads, one from the common flexor tendon and other from the ulna, and it insert on the pisiform bone and the head of the fifth metacarpal bone. Okay, so this is flexor carpi ulnaris. It helps in the flexion of the wrist joint and also adduction of the hand. Okay, and it is innervated by the ulnar nerve. In between the two heads, as I mentioned that it is originated from the two head. In between the two head of the flexor carpi ulnaris. Okay, so this is flexor carpi ulnaris tendon. Okay, this one, and in between the two head of the flexor carpi ulnaris, this nerve is travel down into the forearm. This is the ulnar nerve. Okay, so this is ulnar nerve. So this is the fourth muscle. The fifth muscle in the superficial compartment is this muscle, flexor digitorum superficialis. Okay, it gets its origin by two head. One head is this humero-ulnar head. So the humero-ulnar head takes origin from the common flexor tendon as well as from the ulna, and the second head is from the radius. Okay, so from the shaft of the radius it gets originated. So it has two heads, and it get inserted on the middle phalanx of the medial forefingers. Okay, so these are the tendons, cut tendons of the flexor digitorum superficialis, and it inserted on the medial phalanx. This is proximal phalanx, this is middle, and this is distal phalanx. So flexor digitorum superficialis insert by four tendons on the medial middle phalanx. Okay, and the main function of the flexor digitorum superficialis is the flexion of the metacarpophalangeal joint and the proximal interphalangeal joint. Okay, so this is about the flexor digitorum superficialis. Okay, so it originates from the two head. One is humero-ulnar head and this is radial head. Okay, so this is flexor digitorum superficialis. Okay, radial head of the flexor digitorum superficialis and humeroulnar head. Okay, this one is humeroulnar head of the flexor digitorum superficialis. So it is the fifth muscle and the last muscle in the superficial layer of the interior compartment. Then the flexor digitorum superficialis also innervated by the ulnar nerve. Median nerve. It is innervated by the median nerve, not ulnar nerve. Okay. Then the three deep muscle. The first muscle is flexor digitorum profundus. Okay. Flexor digitorum profundus originates from the ulna and the interosseous membrane, and it gets inserted on the medial four distal phalanx. So it gets inserted on the distal phalanx of the medial four fingers, and it helps in the flexion of the metacarpophalangeal joint and the proximal interphalangeal joint and distal interphalangeal joint. So it helps in flexion of the flexion of the all the joints of the hands. Okay, then this muscle lateral to it is flexor pollicis longus. It also originates from the interosseous membrane and the radial bone. Okay, radius bone, and it gets inserted on the distal phalanx of the thumb. Okay, lateral finger. Okay, the most lateral finger is thumb, so it gets inserted on the distal phalanx, and it is innervated by the median nerve, interosseous branch, interior interosseous branch of the median nerve, while the flexor digitorum profundus is innervated by the lateral half of it is supplied or innervated by the interior interosseous branch of median nerve, while the medial half of it is innervated by the ulnar nerve. Okay. Then the last muscle is the pronator quadratus, which is the deep muscle. It gets originated from the ulna bone and inserted on the radius bone, lower half of the radius bone, and its main function is pronation of the forearm, and it is innervated by the interior interosseous branch of the median nerve. So this is about the interior compartment muscle. So the interior compartment of the forearm, its muscle is innervated by the median nerve. Mainly the median nerve innervates this muscle. So this is the median nerve in between the two heads of the pronator teres, while this one is ulnar nerve, and it passes in between the two head of the flexor carpi ulnaris. The median nerve supplied most of the muscle of the interior compartment except the flexor carpi ulnaris and medial half of the flexor digitorum profundus. Okay, so the medial half of the flexor digitorum profundus and flexor carpi ulnaris, these two 1.5 muscle is supplied by the ulnar nerve, and all the other muscles supplied by the median nerve. Okay, so this is about, and the blood supply is from the radial artery, which is the lateral terminal branch of the brachial artery, and the ulnar artery, which is the medial branch terminal branch of the brachial artery.